Buenos días a todos. Good morning. Vamos a tener o esperamos mucha participación hoy en este seminario, así que voy a esperar unos segundos. Veo que van subiendo los números, pero voy a esperar un poquito para comenzar. Good morning, everyone. I know we have a lot of people registered for this webinar, so I see that the numbers, they are increasing. I'm going to wait a little bit more and we start. I hope I'm building expectation. Ok, bueno, vamos a comenzar. Poco a poco va subiendo, pero veo que va un poquito más lento. Bueno, miren, esta va a ser una conversación mayoritariamente en inglés. So this is gonna be a conversation mostly in English. Pueden escuchar la conversación original en este canal. You can listen to the original conversation in this channel. Pero tenemos interpretación al español y al portugués. Así que se pueden conectar al canal que mejor les funcione a ustedes. We have interpretation in English and in Spanish and in Portuguese. So you can connect to the channel that is better for you. Si quieren conectarse, abajo, en la parte inferior de la pantalla, tienen un simbolito que dice interpretación y ahí pueden escoger el canal. So if you want to listen in another language, you can go to interpretation, that is down there on the screen, and you choose the channel that is better for you. Ahora ya puedo hablar en español, menos mal para todo el mundo, porque sé que mi acento inglés no es de lo mejor que hemos visto en el mundo. Entonces, bueno, algunas normas generales. Como vamos a tener bastante participación, vamos a tener los micrófonos muteados de los participantes y lo que vamos a hacer es que vamos a dejar 15-20 minutos después para tener preguntas generales a nuestros invitados. Pueden utilizar el chat. Yo creo que a través del chat vamos a estar compartiendo información, podemos tener un diálogo, yo voy a estar atento. Y sin más, hoy les dejo con uno de los que yo creo que va a ser de los mejores webinars del año en un tema muy candente como reapertura, y les dejo con Florencia López Bo, que es nuestra economista líder en el BID y una de nuestras mayores expertas en desarrollo infantil temprano. Muchas gracias.
Buenos días a todos, bienvenidos. Sé que estaban esperando a nuestro gerente Marcelo Cabrol, pero tuvo otro compromiso y aquí estoy. Para romper el hielo y para empezar esta conversación tan interesante, quiero mostrarles un videíto. A ver, Pablo, compartimos.
Angry parents gathered to protest the mayor's decision to close New York City's public schools and switch to online learning.
We were promised that decisions would be made based upon data and science. Well, the data and science are in. And
parece que no está funcionando muy bien. Un segundo. ¿Quieres que lo vuelva a compartir? Lo intentamos otra vez, sin que se corte.
Intentemos.
Sí, un segundo. Ahí. Perdón, ¿eh? Vamos a intentar por segunda vez. Share screen, share.
Angry parents gathered to protest the mayor's decision to close New York City's public schools and switch to online learning.
we were promised that decisions would be made based upon data and science. Well, the data and science are in, and the risk of spread in schools is low, and the harm that we are doing to our children is high.
Bueno, parece que eso es lo mejor que podemos conseguir.
Básicamente era una protesta, les cuento a los que no pudieron escuchar bien, una protesta de padres en la ciudad de Nueva York, gritando, abran las escuelas, abran las escuelas, y un papá al final diciendo, nos prometieron que las decisiones sobre las reaperturas iban a ser basadas en la ciencia. Y un poco de eso es lo que vamos a hablar hoy, de escuelas, jardines y preescolares cerrados en nuestra región, América Latina y el Caribe, las pérdidas de aprendizaje y lo que esto significa para el futuro de los niños latinoamericanos. Y todo esto, por supuesto, en el contexto de una pandemia, donde lo que se quiere es limitar la transmisión del virus. So, one of the key decisions facing Latin American countries today is whether or not to reopen childcare centers, preschools, and schools. And these decisions, which depend on understanding the role of children, teachers, caregivers, and staff, and the role they play in the transmission of COVID-19, but recognizing on the other side enormous costs for children and societies from disrupting schooling and care of these young children. So today in this webinar, we hope to provide many policymakers we know we are connected with guidance on whether this is safe, what are the costs, what are the benefits, how to reopen safely. And to answer these very important questions, we have two fantastic speakers. Emily Oster, a professor, economics professor from Brown University, is famous for writing books on pregnancy and parenting that defy the common wisdom. In 2020, she has collected data from the US on childcare and school reopening and COVID-19 infection. Welcome, Emily. Ramanan Laxminarayan is an economist too and an epidemiologist from the Center for Disease Dynamics. And in 2020, he has conducted the largest COVID-19 contact tracing study in India and has come up with very important conclusions about children's role in transmission of COVID. Before going into the conversation itself, I wanted to tell you a little bit of background on Latin America. An IDB study calculated that the pandemic will affect learning dramatically in Latin America. 3 million years of learning will be lost by adolescents only due to preschool closures. Let me repeat this, only due to preschool closures, 3 million years of learning will be lost by adolescents. What does this mean for future poverty? Pablo, if you want to share the screen, our calculations show that this will affect future earnings of this entire generation of children, and those losses will be equivalent, as it's shown in the screen, to 7.1% of the GDP in Latin America, with differences and heterogeneities by region. You are seeing there the Andean region, Caribbean, Central America, and Southern Cone. We are sharing the complete study on the chat for those who are interested. And so as countries are facing these decisions, let's try to answer the questions. Emily, the video was from New York City, and we are lucky because you have been very involved in data collection in that state and looking at the relationship between childcare, schools, and COVID transmission precisely there and in elsewhere in the US. Why don't you tell us a little bit more about your findings?
Absolutely. So thank you so much for having me, and I really appreciate the opportunity to get to talk a bit about this. So just, I think that video from New York set the stage well, but just to sort of be clear on what has gone on in the US, when we have thought about school reopenings in the US, it's been quite variable across states. So there are many states in the US, mostly places in the middle of the country where schools have been open more or less for the entire school year since September. And then there are places where schools have remained closed for most of this period. Almost all of, for example, the state of California, almost all schools have stayed closed. And there's a huge amount of concern about learning loss, about differences in equity, and just in general about how we can do this, but how we can do it safely. So from my standpoint, I sort of came into this question really sort of earlier in the pandemic, but then really in earnest in August, when I, along with a number of other people, recognized that that there were schools starting to open and starting to open in areas with a lot of coronavirus. And at the same time, there was no effort to try to track publicly what had gone on in those schools. And we realized there was an opportunity to learn from what was happening in the open schools about what might happen if other places opened. So we actually started a data collection project, basically a volunteer oriented data collection project in which we try to collect data from as many schools and districts and states as possible to try to track what went on as schools reopened. So I think, I want to share with you really, like, I want to show you what we built and also just share with you some very top line sort of numbers, and then talk a little bit about other pieces of data. So to be clear, what we do in our data is we look for information on how many kids are at a school and how many cases of COVID we're seeing in students and staff. So we're really focused on trying to understand the rate at which people get COVID in schools and how that compares to an overall rate. Is that number big or small? And again, when we started this in August, I think there was a real concern that there might be huge outbreaks in schools, that schools might be super spreaders or sources of big COVID clusters. That has not turned out to be the case in our data or in other data. And so let me sort of show you that now. So I'm going to share my screen. And so this is our public dashboard. And I think in some ways that's an important thing to note, that really there is a lot of value in my view to being able to sort of show out to people, more or less just like show them information directly rather than telling them school is safe or telling them school isn't safe, to really be able to say, well, the reason we're confident or not confident is because of these data, and let me show you what the evidence is. So we have a public dashboard, and we have just like a lot of data on it. So here is really the top line. So our most recent data collection effort is in the first 2 weeks of January. And so in that period, we have information on about almost 10 million enrolled students, of whom about 5 million of them are intending to some extent in-person school. Among that group, what we measure, the sort of simplest thing we measure is the average number of student cases per 1,000 in-person students. So that just says if you had a school of 1,000 students, what would you expect to have? And what our data says is in this period, we would expect about 5 cases. The average school had 5 cases among 1,000 kids over a 2-week period. So that's, that. And again, I think there's a question of, is that a small number or a big number? It strikes me as a fairly small number, but I think that, other people could differ on that. It is also notable that these numbers are higher in staff. So that same, we're covering in that same period about 1.3 million teachers and other non-teaching staff. And in a group of 1,000 in that, we'd expect about 11 cases. So that's a slightly bigger number. And in general, that's very consistent with what we've seen. It's something that's probably really important to emphasize, that when we talk about schools and protecting people in schools, we really are mostly we are thinking even more so about teachers, because teachers and staff are higher risk group, and they are more likely to be infected. But in general, these numbers are fairly small, and I think it's worth saying that these are people who probably many of them were not infected at school. So these numbers don't reflect infections in school; they simply reflect infections on people associated with schools. And so it's a sort of, in some ways, an upper bound of what might have happened for people in schools. With data like this, we can also ask questions about, for example, masking. And I think this is something that's actually probably really important to emphasize, because, for example, a lot of cases in a lot of European countries, they have not had kids mask in schools. Almost all the data that's come out of the US, including ours, has shown that particularly for staff and teachers, having masks is really important. And here, So here is, for example, in places with fairly low rates, we're seeing, staff rates that are much lower if people are wearing masks than if they're not. And these aren't just staff wearing masks, these are students wearing masks too. And I think if there's something that many of us have learned from sending our own kids to school, it's actually perfectly possible for kids to wear a mask all day. Even my 5-year-old does it, it's fine. So this is just one piece of data. And let me highlight sort of one other thing that's just very, very recent, which is that that the CDC came out earlier this week saying schools in the US can open safely, and they're really relying on data from what's happening inside schools. So in some ways, even stronger than our data, they're actually looking at how much transmission is there in schools. And so they have, for example, a study of 90,000 people in North Carolina. And what they're seeing is there are a very, very small number of cases of transmission in schools, and there were no cases of transmission from students to staff, which I think is pretty important for here. So, I would say that what we're seeing out of the US suggested that it is possible to reopen schools safely, and that is, but that it will require masking, and that it is something that, we need to think about how we can protect teachers in particular, but the losses to kids are really big. And I think that's highlighted what Florencia put up initially. And I think that's kind of the other side of this. So let me stop there. I'll put the link to the dashboard in the chat if people want to mess around with it. And I'm interested to hear what others have to say.
Thanks, Emily. Yeah, we are also putting the dashboard in the chat, but go ahead and put more info there. I think this is extremely interesting, and it's so important that last week's CDC report is so aligned and strengthens your findings. Let me have a quick follow-up question before I go to Ramanan. There is a concern in Latin America, but also probably in the US and Europe, that maybe schools don't have incentives to report or even to hide cases or suspected cases. What are your thoughts on that?
So I think, that's, for me, that's part of why the studies that the CDC reported out last week were so useful, because those are really not based on reporting. Those involve testing and contact tracing and more comprehensive work. I also think we are increasingly getting information where the reporting is not by schools. So in a number of places, I think we're going to start getting in information where we can see the cases from a public health department linked in with schools. So we'll be able to kind of look more carefully at that. So there's a lot more data stuff that we can do. But I think that, the truth is, if there were huge outbreaks in schools, we would know, because we would not need, because that would be very visible, and we're just not seeing that.
Thank you. Ramanan, so I wanted to ask you your perspective now. New York City, New York State is very different from India. The analysis that Emily shows comes from a developed and rich country. So we are very curious to know, what have you learned from your contact tracing study in India and the role of children in transmission? Go ahead, please.
There we go. Can you hear me, Florencia?
Yes.
You can hear me, right? Okay, great.
Yeah.
So thanks, and thanks, Emily, for setting that up. I think that was a great opening, and thanks for showing that video as well. Clearly, this issue of school openings is an important issue everywhere, and obviously the setting changes. I'm just going to walk you all through just what we know from various studies, including our own, in terms of risk associated with childcare. I'm not going to speak about the consequences of school closures, which I think you have very good numbers for, and those are obviously enormous. Now, the first study that we had came out of China, and this was just 171 children that we had data on, and who were confirmed to have SARS infection. This was way back early in the epidemic, and what we found was that by and large they had mild to moderate cases. There really wasn't a serious issue with kids, and there was another paper in pediatrics which came out at the same time. So compared to the deaths that we were seeing in adults, the first thing we saw was kids, very small number of cases, and they don't seem to really suffer a whole bunch, especially the kids under the age of 10. Now that sort of changed when we started looking at schools, and Israel is an example where Israel in March shut down entirely. They had a total lockdown. They shut everything, including the schools. In May, they reopened many things, but they reopened the schools, and including high schools. And May is a hot month in Israel. Very small classrooms. They couldn't really enforce social distancing, and they very quickly saw an outbreak. So just a week after when they had lifted the lockdown, they had, in just one high school, they had an outbreak, which then grew into, 260 cases from there. So just the relevant part of this picture is you see this gray, 0 to 9 years. That's pretty small, prior, and also the 10 to 19-year-olds. But you see that 10 to 19-year-old age group is actually quite large following the lifting of the lockdown when they reopened the schools. So there were articles in the New York Times and everywhere else, and what they were referring to is this age group, the 10 to 19-year-olds who were driving the epidemic in Israel. There's still disagreement about how big a role they played, but certainly there were a lot of infecteds amongst that group. Now, there's studies from Sweden, which is, probably has more social distancing than perhaps even in the US. And there they found, that particularly in preschools, but generally in schools with kids aged 1 to 16, which is a typical age group, when they looked at the overall number, we're talking about, studies that were done prior to the summer, 15 children had COVID-related conditions and were admitted to an ICU, which is an extremely small risk. That's one child in every 130,000. Just for comparison, there are other causes of illness that would put a child in a hospital, which is that same risk. So very, very small. Now, there have been studies from Singapore, and this particular study in Singapore found, listen, in preschools, they looked across coronaviruses, including SARS-CoV, and despite screening for symptomatic and asymptomatic children, they just thought the risk is not great, and they concluded that kids are not primary drivers of COVID. And there's been larger studies which have also looked at it, like I said, looking across settings, and they've also concluded the same thing. Now, there was this study that was done, which was basically a systematic review done across different studies of children. And what they found, by and large, was that kids had a reduced odds of secondary infections if those under 20 years old. And they did cite a working paper of ours. At this time, our study, which is a working paper in medRxiv, was a pretty small study. It then grew about 12-fold by the time we published it. But our study was the one that was sort of closer to the neutral part, but by and large showing a lower risk. This study that we conducted, and we have an update that's coming out soon, was published in Science in November. And we looked at 3 million contacts that were traced. And we had reliable testing data on about 575,000 contacts from 84,000 primary cases. And we also looked at deaths, 5,700 deaths. And I have to admit that this study did sort of, we got a lot of questions after this from people from school districts around the world, because one of the things that people looked at was this headline. Researchers also found, and this is in the New York Times, found that children of all ages became infected and spread the virus to others. Now, that is certainly true. We did find exactly that. And we also found this role of super spreading. But it received a lot of attention primarily because, not just because it is from India, it just was the largest contact tracing study, in fact, for any infectious disease in the world up to that point in time. There hasn't been one after. And the previous largest one for COVID was about 1/12 the size, which came out of South Korea. So just the sheer numbers were large, and the update we're about to publish, includes data from about 12 million contacts now, and much larger data set even. So very quickly through the study, this was done in 2 southern states of India. Together, they have a population size of about 125 million, which is, I guess, roughly the size of Mexico, just these two put together. And so, large, I guess, by Latin American standards. And the epidemic, we had data right from the early days of the epidemic, starting from March. So we had incidents through May, through June, and then through July. And you can see as the red lights up, more and more cases happening. And we had a contact definition of high risk, like you were touching bodily fluids of an index case, you're touching their linens, you're living in the same household, very close proximity, or sharing transportation. And there were low risk, sorts of contact, which we were able to separate these two out right there. And the first thing we found was that the secondary attack rate, which is the proportion of people that you are exposing to the virus if you're infected, the proportion of those that will actually develop an active infection is similar in studies in Singapore, in South Korea, in China. It's overall, it's about 1 in 10. It's about 1 in 10 also of households, and it's lower if you're in the community. So this seemed quite consistent everywhere. Now, here's the interesting part. What we found was that children, especially in the 0 to 4 age group, seem to transmit the most to other kids in the 0 to 4 age group. Kids in the slightly older 5 to 9 age group transmitted to kids in that age group, 10 to 14 that age group. Not that they were not transmitting to anyone else, but they were mostly transmitting in these age groups. Now, you have to keep in mind that for the duration of the study, which went through to August, all schools in India were shut, preschools, everything was shut. And this was uniform throughout the country. So unlike in the United States, where there were state level and county level policies, in India, it was a single shutdown and the same policy applied throughout the country. And therefore, we're looking at these numbers at a time when schools were shut. In spite of that, kids were transmitting and probably in the house. What was interesting to us was the fact that kids were not transmitting to the elderly, like you might see for influenza or for pneumococcal pneumonia, which is what you'd expect. They were not doing that. So we were seeing that even the elderly transmit only to the elderly. And this is despite the fact that I think just like in Latin America, in India, there's a lot of multi-generational households, grandma and grandpa living with the aunts and uncles, also living with the children all together. But in spite of that, you have very age segregated kind of transmission. If you really want to break it down to the numbers, you can get the paper obviously off the internet. But, again, if you look at all contacts, it's about 26% are infected out of there were 89 kids in that same age group that were exposed, and about 26% were infected. And you go to the remaining number, the numbers get to be very small. Above 85, actually, there's none at all that's infected. And with high risk, it goes up a little, but not too much. The 5 to 17 age group, it's slightly higher in the other age groups. So the 5 to 17-year-olds behave a little more like the 18 to 29-year-olds. But the under 5 kids, which is the focus of our presentation today, really are not big transmitters outside of their age group at all. They do get infected, they do transmit, but mostly within their own age groups. And everything is summarized in this very nice picture from The Economist. They do much better pictures than we do. And on this axis is age of people subsequently infected, but here's the age of the infected person. So you can see for the 0 to 10 age group, regardless of the age bracket, there's very little transmission, except when you come to that same age bracket, 0 to 10, and that's where most of the infections are happening. Compare that to 20 to 30-year-olds. They're transmitting to everybody quite actively, including their own age bracket and including the elderly. So if you want to protect your elderly, these 20 to 40-year-old people are really the people to really be concerned about. Because keep in mind that we don't have a good handle on children being asymptomatic transmitters of the virus because we don't test widely enough. So the big concern on the basis of which schools were closed was, what if children get infected and take the disease home to elderly people in their households or somewhere else? That's what you typically worry about with the pandemic and so forth. And what we found in a very large data set was that was not actually happening for COVID. We don't really know why, but kids are not the ones that are transmitting to the elderly. So I hope that clarifies a few things. We also found strong evidence of super spreading. 70% of people tested don't infect anyone else, and about 60% of subsequent infections are caused only by about 9 or 10% of people. And in fact, you see these super spreading events around the world. But this was again what we were concerned about in schools. But it looks like, although the schools have not yet been opened here, that on the evidence from multiple countries, we don't really see strong evidence of this. The lockdown did make a difference in both of these places. So if you're looking for evidence of whether lockdowns work, I think there's strong evidence from India that the overall shutdowns do seem to make a difference, but that's not necessarily about schools. So bottom line, kids under 5 face very low risk of COVID to themselves. Risk is higher in the age group from 5 to 17, but still lower than in adults. There's really no evidence that opening daycare or preschool poses a risk to children, students, or their teachers. And we're basing that on the fact that kids are not transmitting to other age groups, even within the household or in their neighborhood. So that's what we see from India. And this is from a very large data set. Children do transmit the virus in settings where schools have remained closed. Kids are mostly transmitting with their same age groups. There's some evidence that the kids in the higher groups play a role in transmission that is similar to young adults. So I wouldn't put the under fives and the older age groups in the same category. I think the under five preschools are probably safe to open. The high schools are probably going to be a lot more like workplaces in terms of unrestricted opening. So with that, I'll stop here. And thanks again for the opportunity to share this.
No, thanks, Ramanan. This is an extremely interesting study. Clearly, that's why it got published in Science. And it's so important that that difference between age brackets, the 0 to 5 or the under 10 you were mentioning at the beginning. And that's why we wanted to focus this webinar on the very young children, because it seems from your studies as well is where the less risk is for them. Emily, I'm gathering a little bit of questions from the chat, but one very important question is that schools in the US and Europe are doing things to limit the transmission, better hygiene, reducing class size, mask use, as you mentioned, super important, and regular testing. What are the main policies that US schools are using, and which do you think are the most critical to successful reopening? Latin American countries might not be able to do all of them or some, but how would you say are the most critical to successful reopening?
Yeah, so I think that, in some ways, encouragingly, the most important things are probably the simplest. So wearing masks, and, here, for the most part, this is cloth masks, not, reusable cloth masks, not some kind of fancy mask. And then the second thing is ventilation. So, it's become, I think, increasingly clear over the course of the pandemic that this is really a respiratory droplet-driven virus. And if you can have better ventilation in the classroom, and that can be achieved with open windows, it can be achieved with outdoor classes, it can be achieved with ventilation upgrades, but particularly in places that are not very cold, it may be possible to achieve more easily with open windows and fans, and that can really reduce the risk of transmission. We know there's just huge differences between indoor transmission and outdoor transmission, and the number of transmissions in those different settings. So I think that those two things are probably coming out as the biggest things that schools want to do. Then, of course, if you want to ask, well, if you had a huge amount of resources, what would you do? I think that many, I would certainly say, I think that in some ways the next thing would be testing, and doing more routine testing, antigen testing, like trying to do rapid tests. And that hasn't been a major component of the US response. I think it will increasingly be a bigger component in schools over the next few months. That is, of course, like a much heavier lift than wearing a mask and opening the windows.
Thank you. Ramanan, given how this virus behaves and your findings on child-to-child transmission, so what you just said, the 0 to 5 transmitted to 0 to 5, what policies or practices do you think would be most successful for reopening schools and childcare centers in middle and lower income countries, like those of our region and like India?
See, the only thing so kids are not causing harm to other kids. Kids are not causing harm to the elderly in the kinds of contexts that we're talking about. The only potential is for kids to cause harm to their teachers, which we don't have strong evidence from developing countries on at scale. So I think the focus really should be on protecting the teacher first and foremost in these childcare centers. So if they can be engaged in frequent hand washing, or they should definitely be wearing a mask, and probably a high quality mask, I would protect the teacher. I think the kids are going to be fine.
Thank you. Yeah, that seems like I don't know, Emily, if you have any reaction to what Ramanan just said, but.
Yep, I agree. Positive reaction. That's exactly right.
Okay, I'm gonna now start gathering questions right from the audience. Emily, number of infections included teachers and kids infected outside as well as in school in your study. Are any comparisons you could provide with kids in schools? That I think is the 5 per 1,000 that you said, vis-a-vis those kids learning remotely?
Yeah, so this is something that we would really like to be able to use, because I think it's a very powerful comparison to say, are kids in school at higher risk than kids learning remotely? Because of the way that data has been collected in the US, for the most part, we do not know information on remote kids and on infections in remote children. But there are a couple of states, actually, notably where I live, in Rhode Island, where they actually collect data on remote kids and in-person kids. And when you do that, what you see is that the infection rates in the remote kids, the kids learning remotely, are, if anything, actually a bit higher than the kids in person, particularly for the older kids. And I think part of that is reflecting, high school students who are not in school they're not sitting in their houses, they are working, they're out in doing other things in the community. And because those environments are less controlled, they actually may be at sort of higher risk than the seemingly quite safe school setting. But that is something, and we can actually see the same in some ways with teachers. So teachers who are teaching where kids are learning remotely, but the teachers are there, that group is just about as high risk as people where the kids are in person.
Thank you. There are many questions related to how governments can adapt measurements to mitigate COVID-19 in schools. And I think, Emily, you gave a great summary, masks, ventilation, and then testing. But here's an interesting question. In Ecuador, schools with 2,700 students, and there is no running water. I think that's a reality, Ramanan, that could reflect also Indian reality. How would you tackle that question? You have many preschools, childcare centers without running water. What's your
that's a good point. It's a common problem everywhere. I would just use alcohol rubs, hand sanitizers, use those frequently. Again, I think it's come back on the chat box as well, saying, is it sufficient to just protect the teachers? And I think if you're talking about preschools and childcare, the answer is yes. Just protect the teacher, get them high quality masks, make sure they have hand sanitizers. The kids, it'll be great if the kids can use hand sanitizer coming into the classroom. I realize that things like ventilation are hard to solve in any short term. It's just not going to be possible. Schools are what they are, and you can't upgrade those in any short period of time. But I think that use the hand hygiene part, and then certainly try to protect that teacher with the mask and the hands, and maybe go over this once with the teachers to not rub their eyes or put their hands near their face and things like that. If they exercise caution, I don't think there's a lot you need to do for the kids per se, because it's really just going to be a question of protecting them. And even there, like I said, our data shows that even when kids are in very close proximity to older people, for some reason, they don't seem to transmit to the older folks. We just don't know why. But this is not common for respiratory pathogens. Normally, if you've had a child in your house who's been to daycare, they will always be the source of infection in your house, right? And that does not seem to be the case for COVID-19.
Thank you.
Yeah, can I just add to that I think that point is very important to communicate. And I think that part of what has been really challenging in kind of wrapping our mind around this is for all of people who have children or work in schools, we are so used to the idea that children are the problem, and that they are the ones who get sick first, and they bring it home to you, and they give it to their teachers, and that they are kind of the germ sources. And that, for reasons, I think, as Ramanan says, we don't really understand that well. That just does not seem to be true here. And I think we need people to understand that. And then that is sort of changing our frame on that will help a lot with both making people feel more confident about being in school, but also teaching them making clear to them when they have to be most careful. So in schools in the US, if we think about what are the sources of outbreaks, most of the transmission in schools, to the extent there is any, is between staff and other staff. And it's occurring because people are letting their guard down in the staff lunchroom and taking their masks off and eating with the other adults. And I think that's something we can kind of control. And we can also say, hey, that's the place that you want to make, that's the thing you don't want to do. You're not likely to get it from the 2-year-old. You're much more likely to get it from your friend. But that's encouraging because people feel much more in control of their interactions with other adults than with small children.
Excellent. Ramanan, Pablo Alfaro has a question here, and whether there is any hypothesis of why small children are not transmitting. I've read about the AC transmitters, but what are your thoughts on why are we seeing such a difference? Because it's huge when we see number of infections. That's between the 0 to 5, 5 to 10, and then all the others trending so differently. What are the channels?
I don't think we even, I've scoured the literature, we just don't know. Some of these have to do with where in the nasal cavity and the throat and the chest, the COVID resides compared to, other influenza or, pneumococcal bacterial pathogens. This is much more in the throat and in the chest cavity, so slightly lower down. And it's actually, I think the short answer is we just don't know. We'll probably figure this out over a period of time. It was a surprise to us because I sort of thought that we would see transmission from kids to all age groups, and particularly the elderly, because I have to admit that back in March and April, when the governments in India asked, well, should we shut the schools? And I did advise shutting the schools because I said, that's a no-brainer. That's really where a lot of transmission actually happens. But I have to say that that's not what the data are bearing out. So, and I don't think there is any study that we know showing that young kids transmit to older populations. Now, the New York Times article said young kids transmit effectively. It is true that they transmit very effectively, right? So maybe the other thing could also be that maybe in the way in which this virus transmits, people have to be in very, very close proximity and really touching each other. And maybe kids only touch each other in that sort of a familiar way. And they don't really touch, adults or elderly in exactly that same way. That's also possible. It's also the nature of physical contact, which makes this possible. But again, I'll go back to my first answer, which is we don't know. We just see what we see.
Okay, we have a lot of people asking about the links to that. We have many questions. I'm struggling with my WhatsApp and the chat and everything, but we'll do it well. First, there's a lot of questions asking for links on your studies and the IDB studies we mentioned. That's for all the audience. Maybe for you not to get crazy, but the chat has all the links to the 3 main studies we have mentioned: the dashboard of Emily, the science study of Ramanan, and the loss in learning and GDP from the IDB study for LAC. But also we have a website on early childhood for Latin America, www.iidb.org/desarrollo infantil. So this was Spanglish, sorry. Pablo is going to put it, Desarrollo Infantil todo junto is in the chat right now, and we're going to be posting this webinar there. All the resources will be there. So that's one thing. Then we have 3 types of questions. One, I think we have asked you many questions. How do we get these results to LAC? Unfortunately, and that's why we have invited someone with experience from the US and someone from India, there are not many studies in LAC looking at transmission in schools, and we hope we will have more in the future. But I think Emily and Ramanan have said quite a few things about that, and we can get back to another type of things. A second type of questions, we have Soledad Garcia and Maria Alonso, many people asking about, would these results that you're mentioning help given the new variants of COVID-19 we are seeing? Do you have any insights on that? I give you the floor to both of you. Difficult question, I know.
No, the answer is no, because we don't really have any evidence. We also don't have the numbers really to work with. So remember that it's now you have to just sequence that. It's a much more complicated study because we don't know in most cases what the variant is. So the answer is simply no, and the honest answer is we probably won't find out for quite some time. But all the evidence is that the new variant is still a small proportion of overall COVID cases. So it's not going to be that important for a while yet.
Emily, you want to add something?
Yeah, I mean, I think that you know, our sequencing is not that good, and I think, you know, in some ways, I think it's important to sort of stay focused on the kind of realities of the public health situation that we do understand. We know that the way to prevent getting the new variant is kind of the same as it is with the old thing, the same kinds of things we'd want to do in schools, you know, continuing to pay attention to the, you know, degree of the virus overall is going to be important. But there's, you know, we just exactly what role these are going to play, and that'll probably be different in different locations. We just don't know yet.
Thank you. Well, Omar Garcia Martinez is asking about any kind of similar study, not on school reopening, but contact tracing like Ramanan. I don't know, Ramanan, if you've seen similar studies from other countries you want to share. I haven't seen anything from Latin America.
I haven't. I shared the studies on the kids. See, large-scale contact tracing studies are kind of hard to carry out unless the system is there. I mean, our study, I mean, we published it, but it involved about 70,000 contact tracers. So it's a work of literally tens of thousands of people who go door to door and find that kind of information. The only other studies that have come out, which are of high quality, have been out of Singapore and Hong Kong and South Korea, and the initial days out of China. And not many kids. I mean, there are not many kids in any of these studies just because they're much smaller studies. I would think, if anything, Brazil might have a study of that size, because Brazil did have a study, you know, has had some big studies coming out of it. But I don't know of a study out of Mexico either, in fact, which is the other place I would have looked for it.
There is a household survey in Brazil. We can share that in the chat as well.
Yeah.
Luis Hernan Vargas, and I'm going to give this one to Emily because I think it will resonate. He says, excelentes presentaciones sobre la posible no transmisión de COVID por parte de los niños, pero cómo llevar a todos los actores a la mesa y ejecutar las reaperturas de escuelas. So he's asking about how to bring to the table unions, governments, and how the political economy of this process is so important now in our region, particularly now because classes in the calendar of the Southern Cone is March. I live in Washington, D.C. There hasn't been one single day of school. My kids are here around. So, and I know that you know, Emily, about the Chicago case as well, and unions. What thoughts do you have on this question of how to bring all the actors together for this decision?
You know, I think it's, I mean, this is really hard. The Chicago case is only the most extreme of sort of what we have seen in the US. And I think that, you know, at least in the US, the kind of lines sort of line up, the teachers unions have been on average less interested in returning to school than others. You know, I think that in some ways the most important thing here is probably not the data, and I sort of hesitate to say that, but the trust and sort of making people feel valued. And so I think in that sense, that's the message that I think that is what has worked in the US. I think we've seen more successful reopenings in places where there is more trust between, say, the sort of teaching staff and parents and the broader community. And you know, some of the way of generating that trust is with communicating, you know, here are the steps that we're able to take to protect you know, vulnerable populations. So you know, here are the nicer masks for the teachers, or here is the evidence on how we're improving ventilation. But you know, I think it's we haven't really solved this. We haven't really solved this problem here, and there are a lot of places that have remained closed despite the fact that it like sort of clearly would have been safe to open.
How, and this is for both of you, Emily and Ramanan, there are many questions on what different approaches for parents and for teachers would you suggest to generate this trust? Because the trust is for teachers to go back to school, but also to parents to come back to school. There was a question from Soledad García Ayala asking, ¿cómo hacer para que las madres y padres tengan confianza para enviar nuevamente a los niños a los centros de cuidado infantil? ¿Qué medidas de comunicación usar? How to leverage communication on this? Any thoughts on how to do that both with parents and with teachers?
You know, that's an important question, because as a parent, you're mostly concerned about your child not posing a risk either, obviously, if you're an elder age group, to you or to elderly people they might come in contact with. Usually, you know, in Latin America, again, multi-generational households, if you got your parents living with you, that is going to be the main concern, which is I don't want to send the child and have them come back and infect my 70-year-old mother, and then something happen to her, because that's such a direct hit. And you know, if she got COVID, that would just be so, you know, it would just be the child's fault for having gone to school, right? So this is very personal now, because so many people are dying, and this is such a, you know, terrible outcome there. So I fully understand that people are concerned about this. You know, it's completely understandable. But that said, you know, I think what we have to look at is balance of risks. Everything involves a risk, and here there has to be a public communication, probably from scientists, but perhaps from people who are joining these, you know, in this webinar itself, who probably hold positions of some influence and authority, that there are many things to be concerned about with respect to COVID. Don't get me wrong, there's lots to be concerned about. I worry about long-term, you know, long hauler effects for people in their 50s, you know, into the next 2 years and stuff. So there's things we don't really know about. In this particular instance, the kids don't seem to be the main issue. And that's why it seems sensible to take them out of the equation. But that has to be communicated through scientists and medical professionals in these countries. They're the ones that the policymakers will listen to and that the parents will listen to. It's not going to be it's not going to be something which you know, people are not going to read papers in science and understand that the risk is really low. It has to come through science communication.
But I would just say, I think that there is, you know, even in the U.S., there's kind of is exactly right that we want to clarify who we should be worried about. But actually, there are a lot of people here who are worried about risks to their kids, and where people's estimates of the risk to their kids are just enormous. So people will say, well, I think, you know, my estimate is that, you know, so something the other day, people estimate if my kid gets COVID, there's a 17% chance they'll be hospitalized. What? That's crazy. The actual chance they'd be hospitalized is vanishingly small. And, you know, so I think part of this is people are still sort of struggling to understand even to understand how small the risks are to kids. And I get every day emails from people who say, well, but what if my kid has asymptomatic infection and then they have a long-term effects on their neurology? And, you know, I read something that said that, you know, even if kids don't have any symptoms, that they're gonna be suffering from this their whole life. There just really isn't anything that would say that that's true. But I think that we need to be working on trying to educate people about some of those things, and, you know, and help them understand that the risks are small, and, you know, they're really small, particularly for kids. It's different for the sort of bringing it home, but for the kids themselves, the risks are really small.
Let me move to a very kind of not that different, but related question. And we have a lot of questions. We have Marta Dormal, Nicolás Leines, and I think it was also María Alonso, asking about learning and remote learning. Durante la pandemia aparecieron muchas aplicaciones para usar en celulares, en las tablets, para desarrollar las habilidades cognitivas de los niños, y sabemos que las escuelas han hecho virtual learning desde los lockdowns. ¿Qué evidencia existe sobre la efectividad, sobre cómo el desarrollo de estos niños ha sido afectado por esto, y en particular para los niños más pequeños? Emily, did you get? You want to start, or Ramanan? It's about the effectiveness of virtual learning.
You know, so I think that first we should say, you know, schools in the US have tried to do remote learning and they've really made a lot of effort. It's really hard. I think increasingly the evidence suggests that, you know, for many kids, it just does not work well. We have seen very big reductions in literacy, particularly for little kids. So you sort of, I think the biggest losses are probably in sort of the first grade, kind of 6, 7, when kids would really be learning to read, which is very difficult to learn to read on Zoom. And I think that a lot of kids are being kind of totally lost. That's the other thing that's happened, is that if you're not requiring people to be in in-person school, they don't get on the Zoom. And, you know, if their parents are not able to stay home and watch them every second because we all have to work, then, you know, kids are kind of struggling to sort of follow through with schooling. So I think we're seeing evidence of losses in the data from that younger group. We're also seeing much higher failure rates in older kids, many more cases where students have multiple Fs, you know, multiple failing grades partway through the year. And we're also, I think we're likely to see much more dropout in high school students. So if you sort of said, like, what are the groups that in some ways are going to be the worst off here in terms of losses, I think it's likely the much smaller kids and actually the much older kids, because of course, you know, if you don't do a great job in the 3rd grade, you can always do 3rd grade again, or we can try to help you make that up between 3rd and 4th grade. But if you drop out of school, then you're not likely to return. And so I think that, you know, we're seeing some information come out about the learning losses. What we still, I think, have almost no idea about is the very likely very large socioeconomic or socio-emotional losses, you know, depression, anxiety, things like that.
Yeah, and I was going to mention Inés Cini in the chat from Argentina. El riesgo a nivel salud es muy bajo. Tenemos que resaltar el riesgo de socioemocional. And Emily just has answered your question, Inés. There are also questions about children with disability, but I think what Emily just said about how difficult it is to a normal, like healthy child to teach him how to read. Can you imagine children with disability, how hard it can be? There are many questions, and I'm going to read a few on when and under what conditions to reopen. I think this is a super important thing. ¿Cómo definir cuándo reabrir? Dice María Alonso, entendemos que para el retorno es importante tener una mirada local de lo que está ocurriendo en cada zona. ¿Tenemos algún parámetro de tasa de contagio por localidad a partir de la cual se pueda considerar el retorno? Es decir, tenemos rangos, ya que si esperamos una tasa 0, tenemos que esperar mucho tiempo el retorno. So asking about the R or any, Ramanan, if you want to start, or Emily, about how and when and what parameters to consider for the reopening.
You know, if you're talking about preschool and daycare, it's not really a function of what's going on the outside. I think we've already said the risks are low, and it makes sense to reopen those right away. I would not do the same thing necessarily for the high school, middle and high school populations until we actually understood, you know, because the scope for transmission in high schools is very different than in preschool and daycare. And I'm glad that this conversation is only about preschool and daycare. They're very, very different. We find that, you know, very clearly, not just in our data, but in other people's data as well. So if it were up to me, I would just open the preschools and the daycare right away. And that's, I mean, that was the conversation, and I think that's what I would do.
Thank you, Ramanan. Very clear. Emily.
Yeah, I mean, I think that, you know, there basically is not a level of community spread at which we should not have those open. And then I think it's more complicated to think about the older kids, and there probably is some level of community spread where it's not it's not a good idea to do that. Although I think we need to understand more about that. And I think in general we should be pretty focused on what is happening in the schools as the threshold for opening and closing them, as opposed to some sort of arbitrary threshold on the outside.
Mm-hmm. And now I have 2 more questions I want to throw to start wrapping up. One is from an skeptical, and Paula Colonna says, if you recognize that we don't know what are the channels and what are the reasons why children 0 to 4 don't transmit the virus, how can we be so sure to advise the reopening? So
yeah, I saw that on the chat. You know, that's sort of a double negative question. We don't have to understand why many things don't happen. We don't have to understand why there are no dinosaurs on the planet. They just aren't, and therefore we don't worry about dinosaurs. So I would put that in the same category. We don't observe transmission here, and therefore, you know, it's not something we worry about. We don't have to be able to explain every phenomenon that does not happen. We just have to be thankful for them and be glad it's not happening, because I can tell you, if COVID were transmitted actively by children, we would have a far worse problem on our hands than we see right now. And typical pandemic influenza modeling does assume that kids transmit. And in that kind of modeling, we worry about, okay, school closure is one thing, but then you're taking all these kids and putting them in a different place where they might be transmitting within their neighborhood. That's a real problem. So let me tell you that, you know, we don't have to understand why they don't transmit, but our observation that they don't transmit, which is quite comprehensive, is really what we should be grateful for and act on the basis of.
Thanks, Ramanan. Emily, a huge number of questions related, Nelly Bermudez and many others. I see many counterparts from Colombia, Argentina, asking about remediation. You have mentioned the gaps that are happening because of virtual approaches to teaching, and this we come out with largest gaps in learning for poorer and richer countries, and in a region, Latin America, that is, to start with, very unequal. What would you recommend in terms of how do we close those gaps, starting already now, 2021 and forward? What do we do to close that?
Yeah, I mean, I think that there's sort of two kind of obvious things. So one is, you know, trying to do more, you know, as the kind of summer arrives and maybe things improve, hopefully, that sort of having some plan for maybe not even this year, but sort of going forward, to have a more focus on more intensive tutoring in the summer for kids. I think the other thing is it may well make sense for some kids to just redo whatever school year they were in now, and to have you know, even though that's kind of particularly for younger kids, you know, I think that's a sort of frustrating thing to think about, and it's too bad. But it is the case that, you know, if you have a kid who should have learned to read over this first grade year and they did not, it is unlikely to make sense to promote them to the second grade when they will actually need to be able to read. So I think we may need to invest in more curation of kind of how we can change the school schedules a little bit for, I mean, it's going to be true here as well, and sort of be more open to the idea that, hey, maybe you need to do first grade again. And I think in the US, we saw a lot of kids just not go to kindergarten. So it's already the case that people sometimes hold their kids back an additional year before entering them in school. That happened to a much greater degree this year. And I think actually the potential losses are small if they end up getting back to school next year. They just took an additional year. That's not so terrible. But I think we need to be a little more expansive in how much we imagine allowing kids to kind of take a little more time in these early years in particular.
Thanks, Emily. One question to Ramanan, because I think this is a very important problem in developing countries, is public transport. So, okay, we reopened preschools and childcares, and we know that they are safe, but how do we get there? How do families get there? Do you know of any evidence, any recommendations you might have?
So again, in the data that I've seen, short-term transport, particularly in open transport, like, you know, with the windows open, poses very little risk if you're masked. So it's only long-term transport for, in our study, 6 hours or more, and within 3 rows of the person, that you actually have a risk. So I think getting on a bus and getting off a bus to take a child to school for half an hour or even 45 minutes is not really a risk factor. And I'll just, you know, just as by way of saying, I recognize these are difficult because we're dealing with a brand new risk. When you're crossing the road in Mexico City, you know what the risk is of being run over by a car, and you decide whether to cross the road or not. Here we're dealing with risks which people don't really understand, because nobody understood this. So in the starting days when people said, can I touch my newspaper? Do I need to desanitize my vegetables? Do I need to, wipe off the packaging? We've come a long way from that, right? We don't do that. We still pick up the paper now and we do that. That's because we were trying to understand risks of something that is brand new to us. And I think now we'll understand this risk as well, that this is not the major risk. Definitely, not wearing a mask in public spaces is a risk. I think that's the one thing to really, drive home as a message. But I think as long as you're wearing a mask, you can be out in the public space. I think you saw in our study as well, your risk of transmission within the household is 9% of the secondary attack rate, which means 9% of people in your household will get the disease if one person is infected. The number for transmission in the community is 2.6%. So you have only a 1 in 3 or 1 in 4 chance of catching the disease in the community, even when exposed to someone, compared to being in the household. So in fact, your highest risk, and this is seen in South Korea and China as well, your highest risk is actually within the household.
Thanks, Ramanan. I have 2 last questions because otherwise we will keep on talking until tomorrow. But this is Iris Asensio with the topic of the year, which is vaccines. How can we assure the security of kids without a vaccine approved for this population in the short term? What are your expectations about the immunization for kids below 12? I know, Ramanan, if you want to answer this question.
I think it's early days yet, just because we haven't had the testing done in those age groups. Those are much more challenging age groups for a number of reasons. The kind of clinical trial that has to be done is much more expensive. We also need to have enough infections in those age groups to do a trial. And because the numbers of infections are so small in these age groups, it requires a much larger trial to validate a vaccine for children. So I would not hold my breath for a childhood vaccine just yet for COVID. It's going to take a while. And in fact, the strategy we're following now throughout the world, which is vaccinate those with voluntary risk, which is the healthcare workers, those with involuntary risk, which is the elderly and with comorbid conditions, and then everyone else to achieve some sense of herd immunity. I think that's perfectly right. And we can get there even without vaccinating the kids.
Thank you. I want to finish reading the question from Mayumi Fuse, which is a very personal and from a child perspective. I'm going to read in Spanish, just warning the translators. And because we're talking about children, it's good to close with a perspective from children. So Mayumi dice, tengo una sobrina que le angustia mucho el tema del virus. ¿Cómo manejar su angustia y la ansiedad a la hora de volver al jardín, a la escuela? Any thoughts?
That was beyond my knowledge of Spanish, so maybe Emily will have to do that.
I'm happy to translate. It's a participant asking about her niece that is very, very stressed and has anxiety about the virus. So how to handle that in the children at the time of reopening?
I will say every kid is different. But when this first happened in the spring, my kids' school sent home like a little cartoon book, which really focused on the idea that kids themselves were at low risk and had some pictures of people washing their hands. And I think that was pretty helpful. That was pretty helpful. And I think the other thing is that we probably don't give kids enough credit for their ability to understand. So even with something like the vaccine, trying to explain to kids how the vaccine is going to work, why it's going to protect you, how the science works, I think they can get that. And this is probably revealing my own biases, but I do think that understanding kind of how the virus works, why is it going to be safer if you're wearing a mask or washing your hands, that those things can help people feel confident, and that includes helping kids feel confident.
Great, thank you. So se nos acaba el tiempo. I just want to thank you from the bottom of my heart to both of you. I know you have conducted amazing studies, and I'm so happy you were able to make it and share it with our government counterparts and an audience in Latin America. Obviously thanking the audience, and Marcelo, who is here now. I want to give you the possibility to thank everybody, and we will share everything in the chat as well later.
Thank you very much.
Thank you so much for doing this.
My apologies to both Emily and Ramanan for not being here. I was listening to the conversation. It was fascinating. So thank you again. You know, I think that just judging from the number of questions that we have, this is one of the most relevant conversations that we had in the last year, I would say. So thank you again. Thank you to Florencia for doing this and replacing me. But above all, thank you to the whole team for putting this together. The conversation is going to be available. I'm going to let Pablo tell you how, because if you want to rehearse the conversation and see the conversation, you can have it. It's going to be recorded. It was recorded and it's going to be there. Emily, Ramanan, again, thank you very much for your time.
Well, thanks for hosting this.
Thank you.
Sí. Me sumo a las felicitaciones, tremenda la actividad que hemos tenido el panel, hemos intentado responder a todo lo que hemos podido, pero la verdad es que el volumen de preguntas ha sido bestial, yo creo que debemos estar entre las 200, 300 preguntas. Bueno, vamos a tener toda la conversación online, yo lo he compartido varias veces, pero nuestro blog es Primeros Pasos. Bueno, si buscan Primeros Pasos IDB, nos van a encontrar, idb.org. Yo de todas maneras les voy a poner aquí en el chat, antes de despedirnos, les voy a copiar el URL para que lo tengan directamente. Y eso es todo. Nos pueden contactar a través del blog y nos pueden hacer todas las preguntas que no hayan sido contestadas. Thank you, everyone. Take care.
Gracias.
Hasta luego.